right, here we go. So I'm driving and I'm about to pull into my house. Today is Wednesday, the April 18th. Yeah, April 18th. And I just had my midterm. And I'm driving home here. Don't know the score. I don't know what I got. Probably won't find out for like 6 or 7 hours from now. Sorry if this is all bumpy, guys, but that's the way it goes. And I figured, like, I'm driving home and just kind of, reminiscing on why I want to be a nurse, why I enjoy working in the emergency department, and how I keep my sanity with my life. So that's kind of loud. So I'm just kind of reflecting on why I enjoy working in the emergency department and why I enjoy nursing. And I think I really enjoy producing excellence with my brain, thinking, using my thought process, and having a beneficial outcome to another person's life, whether it be the hospital team, the patient, the family of the patient. Having a positive outcome for affecting another person positively in a dire circumstance where if the system had not been in place that you get to be a part of, if it wasn't there, there would have been much worse outcomes. So I really think it's great to watch people come back to life. We had I was working a few nights ago and we got to bring somebody back to life. That was pretty cool. And hopefully his kidneys are still working. That was 4.8 when we got him, with no blood pressure. Took a manual blood pressure like 6 times. No blood pressure, but he had a pulse. We had femoral pulse, but on his arm, brachial, I was getting like 30 over 20 or 40 over 20. We got 2 units of blood in him. We got 2 units. I slammed 2 units of blood in his. We got a central line, femoral central line. Slammed 2 units of blood. Slammed 2 units or two big bags of saline. We got a pressure of 70. We ended up getting back like a pressure like 100 over 60 before we took him to CT. Anyways, it was cool. It's really cool to be a part of that system, and it was really cool to have a direct impact on this person's life and be able to kind of bring them back to life. So I really enjoy that. I really enjoy the excellence it requires to have these awesome outcomes, and I love the team aspect of having multiple nurses, multiple doctors, multiple ancillary staff like RT and pharmacy, having us all come together with one valiant effort to, stabilize this person, get us some data, because we have 0 data in the trauma center. Trauma patient comes in, we have such little amount of data. Precipitating factors are very limited. We have no, it's just awesome. I just love it. So I thought I'd just rant about why I love working in the ER, and I guess this thought that I have of, enjoyment and really be feeling fulfilled in my life. And by the way, these are free glasses I got, so these were given to me at the transfer day or whatever at the college. So I'm like, hey, I'll take some free glasses because I don't have glasses because I'm pretty broke as a joke. But that's the beautiful thing about this job, that I'm doing right now. Yeah, I'm not getting paid a whole lot of money, like 20 something bucks an hour, and I'm only working 2 nights a week, and I'm super broke as a joke. Can't afford my own glasses. I'm wearing, probably 10-year-old sweatpants right now, and 10-year-old rainbow sandals, and I don't actually have a pair of shoes. Anyways, I'm fulfilled, and I'm like super stoked on life, and I'm just super happy to be doing, playing the role, because I don't even like to call it a job, honestly. I like to call it, because you're really fulfilling a role, or it's a job. Of course, we're getting paid and we're clocked in, and but it doesn't feel as much like a job as it feels like a passion and like a calling, because you get to be in a position of highly skilled responsibility. I don't know, I just really love it. And so while I'm taking this OB class, guys, I suck at OB. I'm getting better. I'm learning. I don't know what this midterm is. I got to study for literally like 3 hours last night on 0 sleep. Or I got 3 hours of sleep in the morning. So I worked, 2 nights in a row. And then I had an interview for a new job yesterday in the afternoon. So I got a little bit of sleep, had my interview, got home, chowed, and then I studied for a couple hours and crashed before my midterm. So it's a little stressful. And now I'm here parked in my house, about to go in, see my babies, and I got some food for them. So I just thought I'd just sit here and take a few minutes to just kind of debrief and talk about why I'm enjoying what I'm doing, and how I guess I get through the pain of a class that I don't excel at. So I don't excel at OB. I know the basics. I know different stages of labor, how to, when a patient comes into the emergency department, what do I need to know about this person if they're pregnant, different, trimesters, based on their trimester, based on their timing of contractions, how they present. I can decide, okay, does this person need to be assessed in the ER? Does this person need to be assessed in go up to labor and delivery? So I feel pretty good with taking care of the patients, but testing wise, it's definitely hard. So I don't know what I'm going to get on the test. I really hope I pass. I think I'm going to pass. I think it was a 60 question midterm. I think I missed maybe 10. I can miss up to 14 and still pass with a 76. 75 is failing. So I think I can miss 15. Hopefully I pass. Hopefully. I think I will. I don't know for sure. But I thought I was just going to talk about it, and I'm repeating myself, but I don't care. So yeah, it's really nice to have like a profession or a skill like nursing when you truly enjoy what you're doing and you truly enjoy the process and the team aspect of resuscitation and assessment, and differentials, getting a differential diagnosis and deciding what direction you're going to go in your care. And you're the kind of the decider, you and the team, respectively, are making the decisions and having an active role in the development of a care plan or development of a plan to keep this person alive or bring this person back to life. So that's really fun for me. I really enjoy that. I really find fulfillment with it. And, my wife thinks I'm kind of sick because I enjoy the higher the acuity, the better. So I love the highest acuity possible, honestly. So that's what I'm looking for when I get out of nursing school, I guess. I really, really enjoy that process of thinking and that the type of decision making and the skills that are required that you need to perform to be able to bring that person back. So that's my thought. That sentiment is what's pushing me through this OB class that I'm not like excelling at, like ACLS and PALS. Like I think I excel at that. I enjoy it. I really love what's involved in diagnosis and treatment of that kind of circumstance. Whereas OB just gives me stress thinking about it. So that's kind of where I'm at. I got 4 weeks left after this. I got a clinical tomorrow. Get to see babies born tomorrow, so that'll be fun. First time in OB. My only other experience with OB is, helping deliver my own baby. Got to pull my own baby out, my wife's vagina, so that was kind of cool. But that was my only experience, and it went like as picture perfect as possible. So I really don't have much of a reference for all the ranges of possibilities that can happen. So it was basically picture perfect pregnancy and delivery. So, she didn't take a single pain medication, she just kind of, some people shoot down the Bradley method. She kind of did a Bradley method pregnancy. So whatever, it's the way it went. It was fun. I had a blast. We enjoyed it. We had a good time. But, when you're in OB, now you're learning about all the diagnostics, all the possible things that can go wrong, just everything that was not part of what I knew. So it looks like my wife's calling me right now because she's wondering where I am because I've been sitting here for 10 minutes talking on this thing. So I'm going to decline her phone call. I'm going to stop this video and I'm going to go in there and talk to her. So that's where I'm at. We got 10 minutes. And I'm going to try and do more of this. I don't know, if you think it's interesting or you have comments, please give me a comment or something. So that's all I got, guys. See ya.